Hello, everybody. So in this third part, what we're going to talk about are more electrical or electric-based measures of the brain. So these are electric measures to help us visualize what the brain is doing. And the first one we're going to talk about is a technology called transcranial magnetic stimulation, or TMS. And this particular approach isn't really a measure of neural activity, but rather it's a tool to help us alter neural activity. And so in this technique, basically what we have is we have a figure eight wand. And that figure eight wand, what it does is it generally creates a magnetic electronic pulse. And by applying that strong magnetic field, what it does is it alters neural activity. So it can either activate or deactivate certain brain structures. So one way to kind of simply think about this is it can basically turn on or turn off different areas of the brain. And then so with this technology, what happens is researchers or clinicians will turn on or off whatever area of the brain that they're interested in, and then observe what changes in behavior occur. Now, one of the things that scares people whenever we talk about this is the fact that you can either boost or deactivate certain brain structures. And I will say this is a really relatively quick, simple way to do that. This isn't a long-lasting thing. It's not the equivalent of cutting out a brain area. This is a temporary change, and temporary on a very, very small time scale of fractions of a second to up to a couple seconds. But why this is really helpful is this is a tool where we can go in and basically do the same thing that we might do in animal studies where we cut out a certain area of the brain and see how behavior changes after that. But we can actually do this to humans and it doesn't have significant effects. So this is a pretty safe technology. It's used commonly, especially in the research world. There is a list of criteria that participants must meet in order to be able to undergo TMS studies. And as far as the number of negative effects that have happened because of TMS, it's very, very limited. So I do want to kind of stress that this is a safe technology, even though it sounds scary. It's also really helpful because it allows us to basically get a better understanding of how the brain or what areas of the brain are involved in certain behaviors. Now, one of the limitations to this approach, though, is that because it creates a strong magnetic field and also basically turns on or off the electrical signal in the brain, one of the problems or one of the things that this technology has to do is it has to go through the skull. And the skull is not really good at conducting electrical energy, right? If we try to pass electricity through the bone, it's not going to work very well. It's not a great conductor. So whenever we're talking about TMS, we're really limited to the cortical regions of the brain. So they are working on technologies to get a little deeper into the brain, but usually when using TMS, all you can really do is focus on the outer layer, the cortex of the brain. And so this has been a really useful tool, especially in language areas like Broca's or Wernicke's, where you can either activate or deactivate those areas and basically recreate what we already know based on the neuropsychological populations that have had damage to those areas. So it is a really interesting technique and super helpful, relatively safe. One other thing that I want to talk about just very briefly whenever I talk about this is a related technology, and it's actually the same exact thing as TMS, but you may see a little case or lowercase r TMS. And what this RTMS means or stands for is that it's just repetitive transcranial magnetic stimulation. And so this is used in a range of different clinical issues. And so the example that I'm most familiar is that it's been used to really work with and deal with intractable depression. So people that have depression where psychotherapy isn't working or medications aren't working to help treat their depression. And so what patients end up doing is they go to an RTMS lab. The person that's doing the measurement isn't holding the thing above their head. There's a very constrained and focused way of holding it so that you make sure you're hitting the same area of the brain. And it does this over an extremely long period of time. So just to give you some sense of what I mean by a long period of time, usually people undergoing RTMS go in Sessions are roughly about 40 or 50 minutes in order to be able to do that, and they're doing that 5 times a week for 4 to 6 weeks. So it's a pretty intensive therapy. It requires a lot of time. However, there has been a lot of success with RTMS, especially in those cases where nothing else seems to work for depression. It's also been used in a range of other disorders. So I know, for example, it's been used in Parkinson's, or it's at least been tried in Parkinson's disease to see if it can help with Parkinson's disease, or I'm trying to think of some of the other ones. It's been used across a range of different disorders. For some reason, they're escaping me right now. So it's a pretty effective therapeutic tool that you're going to see around presumably more and more. It's becoming a little more common, and this technology is developing more, and so people are more comfortable with it. And it's also been tested more in research studies to see how well it can work to work on different disorders. So hopefully that explains a little bit about transcranial magnetic stimulation. And we're going to switch gears and talk about another technology that's always super hard to pronounce, but it's electroencephalography, or EEG. And in the case of EEG, what you're doing is you're measuring electrical activity on the brain. So you may have undergone an EEG scan. They're really common in sleep studies where they're trying to figure out why people might have some problems sleeping. They're also really common in if people have issues with seizures. And so it's a way to measure the electrical activity of the brain and what might be happening in the brain when people have issues with seizures. So in this technology, basically what they do is they have a bunch of different electrodes, and that's these individual little dots that are up here on this person's head. And they put a gel on it. So if you've ever gone EEG, one of the things people always complain about is how messy it is, because in order to get the best electrical signal, they have to put something that's really conducive or conductive underneath the electrodes, and so it results in a bunch of basically goop in your hair. And then what this technology allows for is, depending on how many electrodes you put on the brain, so this is a pretty across the brain EEG setup, but you could also do it with just a couple different electrodes. It just kind of depends on what you're looking at and how focalized it is that you're looking at it. So if you knew exactly where in the brain you wanted to look, you could get away with just a few electrodes. So what these electrodes are picking up is they're basically picking up the electrical impulse created by the action potential. And so again, just like whenever we were talking about single electrode recordings, here there's an electric signal that's generated, and then these EEG electrodes are picking up on that electrical signal. Now that electrical signal is really, really faint. It's very faint. And so what ends up happening is the information that's picked up by these electrodes is very, very faint. So it needs to be amplified, just like when we talked about microelectrode recordings, and put through an amplifier, and then we can look at the data. Now we can look at the data in two different ways. One of the things that we can do is waveforms, and I'll talk about that in an upcoming slide, where we look at the general pattern of electrical activity. It's a much broader, bigger scale of looking at electrical activity in the brain. Typically, these types of waveforms are used to look at either states of consciousness or pathology. So these waveforms are typically used in seizure studies where they're trying to see what the general overall pattern of electrical activity in the brain looks like in somebody that may have seizures, especially pre-seizure states. And then you can also look at something called event-related potentials. And this is kind of a more focused look at looking at how the electrical signal changes whenever somebody is presented with a particular event. So for example, maybe you're interested in what's the brain's response to seeing cute kitten pictures. So what you're going to do is look at the electrical signal as you present pictures of, say, flowers, dogs, cats, and you're going to compare what that electrical signal looks like to each other. We'll come back and talk about those in the upcoming slide, but I want you to be aware that at least whenever we're using EEG, they can be measured in two different ways. Now, some of the pros of EEG are it has extremely great temporal resolution. So unlike fMRI, where there's the hemodynamic response, which results in really bad temporal resolution, in the case of EEG, we have really good temporal resolution. We can see on the level of milliseconds when we present stimuli to somebody and when we see a change in the electrical activity of the brain. So it has really great temporal resolution. However, it has horrible spatial resolution. Because the electrodes are so far spaced, as we can see in this gentleman with the EEG here, we don't get really fine detailed information about exactly where in the brain that electrical energy is happening. We're looking at kind of very broad, very gross electrical activity in the brain. And so for EEG, one of the pros is we have great temporal resolution. However, we also have really bad spatial resolution. Some of the other cons of EEG, I mean, it's relatively cheap, or well, I guess this is a pro, but it's relatively cheap in order to do EEG, especially compared to fMRI and those types or those technologies. But then also it is burdensome for the patient, or whoever's undergoing the EEG. So it takes a fair amount of time to set up, as you can imagine. They don't just throw electrodes randomly on the skull. Instead, what you do is you have to be very careful about how you place them, and so to make sure that they're placed at roughly the same spot in every individual. And then also, like I said, it requires putting some sort of a conductive material jelly underneath each of the electrodes, and so it tends to be very, very messy for participants. And it also, as we'll see here in a second, it just takes a really long time. Compared to fMRI, where you don't really have to have a participant do much, they can just go into a scanner. Here, it's a lot of setup and tear down in order to be able to collect EEG measurements from people. Now, kind of talking broadly about EEG, one other thing that I want to point out is, so when we talk about EEG, we've been talking about how great its temporal resolution is, but how horrible its spatial resolution is. And fMRI, it's the exact opposite, right? Really great spatial resolution, but really horrible temporal resolution. One of the things that can be done is that you can actually combine these, and it's somewhat difficult in order to combine these, right? Because usually, in the case of electrodes, there's metal in them, and so you can't put them in a magnetic field. But there are EEG systems that don't have metal and whatnot, and you can actually record both EEG and fMRI at the same time. And so this has been one approach that some researchers, especially, have been leveraging in order to be able to get both the great spatial and temporal resolution to understand or to visualize the brain. So these can be done, although it is very difficult. Logistically, it's a little bit of a nightmare because you add on all the pros and cons of each of the techniques with each other. But it is doable, just in case you hear about studies where they've looked at both fMRI and EEG at the same time. Now, taking a step back to what we were talking about earlier, the two different ways that you can measure EEG, the first I want to talk about the wave approach to measuring EEG. And so you probably heard about these waves in some of your other classes. So for example, I believe with sleep, it's the delta waves that are really common if you're in a deep sleep. And you might have also heard about other alpha waves if people are really, really relaxed, and so on and so forth. And usually whenever you hear about alpha or delta or beta waves, what you're hearing about are kind of the general patterns of electrical activity across the brain. So you can think of this as thinking of what general state is the brain in? Is it kind of within a certain electrical frequency range, which is what places you in each of these different waves? Is they're just layers of frequency ranges for electrical activity in the brain. And you can use these waves to get a rough idea of what general or broad state the brain may be in, whether somebody's asleep or if they're awake and completely and mentally aroused. So that's how waves work. Now, when it comes to event-related potentials, or ERPs, here, typically what ends up happening is that you have a participant. So going back to our cat example, you're just really interested in how the electrical activity of the brain changes whenever people see pictures of cute cats. Then what you're going to do is you're going to present a bunch of pictures of cats, flowers, and puppies or dogs to participants. And you're going to present these pictures multiple times. And you're just going to have the participants sit there and watch the picture, but you're going to use the timestamp of when you presented that image and look at how electrical activity changes. Now, because the electrical signal is so tiny and so weak, one of the things that you have to do is you have to collect a lot of measurements from each participant. So you have to present them with a ton of pictures of cats, a ton of pictures of dogs, and a ton of pictures of flowers. And basically what you get are these really small signals that look something like this here. And as you look at each of these individual signals, it's really hard to see any pattern, right? And so basically what you need to do is, because it's hard to see a pattern, you need to present a lot so you can get a really nice average waveform and see what that average waveform looks like. So in this particular case, here's a bunch of, here's the average waveform when nothing's happening, and here's the average waveform when something is happening. So I guess I should step back and say this is actually just background electrical activity in the brain, and this is the electrical activity whenever you're presenting pictures of cute cats to participants. The same thing applies. Even though we see some general patterns and it's a little clear to see that the electrical activity in the brain's changed here, it's not as clear to see as it is in the case of when we average all of them together and we get this nice, really nice, clean, clear dip that's going on. Now, what we can tell is we can, I don't want to go too deep into this, but we can actually break up the individual spikes that we see here in this EEG signal, and it corresponds to different things that might be going on with the brain. But the main thing that I want you to see is that we get a nice, really clean, clear picture of the electrical activity whenever pictures of cats are given to participants. And so we can interpret this wave to let us know exactly how the brain and different regions of the brain may respond to seeing pictures of cute cats. So when it comes to waves and also ERPs, I realize that this is relatively complex, and I don't want to get too far into the weeds with it, but I do want you to walk away with a knowledge and understanding that there are two different ways that we can measure electrical activity in the brain through EEG, one of which is waves, which is kind of a broad, across the brain, general electric state of the brain, and the other one is looking at specific regions of the brain and how those specific regions of the brain may respond to a specific type of stimuli, whether it's the response to cute cats, or in the case of things that people might be fearful of, it might be their brain's reaction to something that they're fearful of. Yeah, so that is event-related potentials. And that actually wraps up our both conversation of visualizing the brain, but then also wraps up our conversation of some of the electric-based measures that are used to image the brain. Per usual, if you have any questions, please feel free to reach out. I'm happy to help.